Friends, I've got to talk to you about progesterone levels and drawing progesterone levels in the luteal phase to assess adequacy of progesterone. And there's so much confusion about what the utility of that test is. We have the ability to measure progesterone in the bloodstream. Okay, that's called a serum progesterone. And progesterone is a very important hormone for pregnancy, hence the name progestation. We kind of try to translate that into reproductive outcomes. But we have a major problem with that. So we have the ability to do it, actually output a level. That's not a problem. The problem is that what that level represents. Does it represent something valid or useful, right? The background of the issue around this problem is that the progesterone is made in your body in what we term a pulsatile fashion. So that means that it's excreted into the bloodstream irregularly in pulse-like intervals. And that comes from its source. The signal to make progesterone is in pulses. And that source is something called LH, or luteinizing hormone. And luteinizing hormone comes from the pituitary gland, which is a gland at the base of the brain, kind of the master regulator of hormones around the body. And that is what releases LH in a pulsatile fashion, and therefore progesterone does the same. So who cares about that? But the point is this: if you go to the laboratory and you draw your blood and they give you a progesterone level, we have no idea, is that representing a pulse that just happened, so that's the maximum level, or is a pulse just about to happen? It depends. Did you walk into the laboratory at 12, at 2? We don't know. We have no idea what's going on in the body at that moment. And so a spot check, it really doesn't help us, because if it's low, then it doesn't really tell us if it's just about to go high. So it's really limiting in terms of what it tells us. One thing it does tell us, and generally agreed upon, is that it tells us if you ovulate or not. So that's not a level, that's more of like a plus minus or a yes, no, did you ovulate? And most of us agree that a level of 3 nanograms per milliliter, sometimes we use 5, but generally speaking 3 would indicate ovulation. So that's the purpose of that test. So if you have that test done, it's above 3, you can pretty much rest assured you ovulated that month, or at least you converted into the luteal phase. You can be confident with that outcome. But please, please, please do not try to assess adequacy of progesterone in the luteal phase by a single serum spot check.